इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ, सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. The period right after childbirth can bring a string of physiological and psychological changes in a new mother, which can be overwhelming. And the right way to approach this is to get the right guidance and take appropriate action in the right time so that you can bring your health back into a shape after childbirth. To help you with this, in today's Apollo 24/7's Health Hour, we have invited Apollo's Senior Consultant Obstetrics and Gynaecology, Dr Geeta Chadha, to this live session. Join us at 11 a.m. and ask all your questions in this live.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Good morning, Apollo family, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you an Apollo's expert every Sunday. And in this live session, you can ask all your questions and queries that you've been postponing or you have been postponing that physician's visit for a very long time. So we bring you an opportunity of clarifying your doubts on this online platform. I would request all our viewers, wherever you're watching this show on, it could be Facebook, it could be any other platform or a social platform. But if you want your question or a query to be answered, please type your question only in the YouTube chat box so that I can post the question to Dr. Geeta Chadha. Today we are going to talk about getting back on track after childbirth. We have invited a senior consultant obstetrics and gynecology, Dr. Geeta Chadha from Indraprastha Apollo Hospitals, New Delhi, who will be joining us very shortly on the show. In the meanwhile, let me also tell you that this show is going to have a health quiz where you can participate and win prizes from Apollo 24/7. Also, we are giving away discount vouchers and coupon codes which can be used on Apollo 24/7. I urge you to download Apollo 24/7 app and get multiple benefits, literally having entire Apollo in your in your hand. All right, so let's start the show. I would want to bring your attention to this wonderful initiative which is done by Apollo 24/7 and Apollo Foundation. This is called SACHI, Saving a Child's Health Initiative. In short, it's called SACHI, which is free pediatric consults for every child in need. SACHI, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost, which benefits children across India. More than 10 plus pediatric specialties from who are Apollo physicians, pediatricians who are very renowned Apollo pediatricians. They are available on this platform. So if you know somebody who requires SACHI, please go ahead, share this good news with them. Scan the QR code which is on the screen to know more about this initiative. All right, let's come to today's topic. Childbirth is something that takes a toll not just on the mother but also on the entire family. So if it's a first child, then all the more anxiety and all the more questions. So here is an opportunity for you all to ask all these questions on how to get back on track after childbirth. Joining us shortly is Dr. Geeta Chadha, Senior Consultant Obstetrics and Gynaecology from Indraprastha Apollo Hospitals, New Delhi. She has more than 33 years of experience and she is a professional member of Association of Gynecologists of Delhi and FOGSI, Delhi Gyne and Endoscopic Society of Delhi, Menopause Society, and she specializes in many fields. Special interests are minimally invasive surgery. She's performed many hysterectomies in women with benign gynecologic conditions through Note surgery. And her awards and achievements include recipient of Bharat Nirman Award for Best Women Achiever, FPR Best Paper in Research by AOGD, and many research and papers on placental grading and its correlation with fetal lung maturity. Here's Dr. Geeta Chadha. Now, good morning, ma'am. Welcome to the show.
Good morning, Jhansi. Thank you for having me
Wonderful
over today.
Thank you, ma'am. It's our pleasure having you on a Sunday morning. We expect you to be very busy, but giving time to meet our audience this way, it's our privilege, ma'am. Thank you so much for joining us this Sunday. Yeah. So, ma'am, as I was talking, childbirth is it's a very precious thing for many women, especially the first childbirth. Gives lot of anxiety. So to understand the 9 months and delivery, it's a very different. Both of these are two different things. People take care of the first 9 months, and then when it comes to delivery and post-delivery, there are questions which are unanswered, and women are looking out for information in many platforms. So the anxiety, is that normal after childbirth, ma'am?
Yeah, so anxiety is how to get back to normal after childbirth?
Yes.
Are you asking me that?
Yes, ma'am.
Yeah, so if the childbirth has gone smooth, so when I say smooth, that means either a woman has delivered vaginally or through abdominal cesarean section. If things have gone smooth, then it's by the time she gets home from the hospital, she's already on her feet because the doctor will make sure that she's only discharged when she's up and about. And with the technological advances, better nursing, better surgical equipment and OTs, infections which used to plague us earlier are now not seen. And with good medicines that she's been taking throughout pregnancy, like iron, calcium, these women are up and about. For instance, if I deliver a woman, many of them say after vaginal delivery next day, Doc, can I go home because I feel well and I'm up to it? And after a cesarean, after 48 hours, they say, can I go home? And I said, no, it's a 3-day package. So you stay here till you feel even better. So the whole ball game is different. Women are on their feet, they're active, and recovery in a normal, uneventful delivery is smooth. The problem comes when things take a turn. Yeah, tell me.
Sorry, yes. So you mean to say when it comes to normal vaginal delivery without any events, as you mentioned, of course, in the bracket, which is very important. So what is the time frame that you were suggesting that one can actually go back home?
So, see, if it is your first baby, we normally keep women in the hospital for 48 hours because the baby's jaundice is being monitored by the neonatologist because the jaundice starts peaking by day 3. But if somebody has had a normal baby before, it's a second pregnancy and they've just come and delivered, there aren't any stitches at the bottom. If everything is going well, within 24 hours, a lady wants to go home, and I tell her, no, hold on. You've got double trouble. One baby at home and one who's just come. So recover. 48 hours, they're up and about and they're willing to go.
Right, right. So how about the cesarean section, ma'am? How difficult is it to get back immediately, and how much time will a C-section take for a woman to recover?
See, a clean cesarean without any complications in a woman who's had either complications before cesarean or during cesareans, she's sometimes, when I have women who have delivered vaginally before in a second cesarean for an indication which couldn't be avoided, they say, Doc, I've recovered faster in a cesarean. So when I see cesareans being damned, I feel that one should be very realistic and take a call and not scare. There shouldn't be a blanket scare imposed on people because there are valid indications for which a woman goes in for cesarean. And in a safe OT, safe environment, good antibacterial, avoiding infection, cesarean patients are also up and about. They go home. They're doing well and they're looking after their babies.
That's nice. So, madam, I see that your picture is frozen for a sec. Let me just see if you're back on track. Yes. Now I can see you, ma'am.
Yeah.
Now I can see you quite normally. Yes, yes. So, understanding that cesarean is not that scary at all, but then the issue, the entire trauma or past experiences of women who have gone through this is what we understand, right? Any new mother looks up to experiences from other mothers who had been mothers earlier. So do you mean to say that there are changes in the way that we approach cesarean sections, or how the way that you do surgeries now? Is there a difference from earlier or to now?
See, earlier people were having many babies, Jhansi. They were delivering many babies. Am I frozen again or you can see me? Yeah.
No, ma'am, we can see you.
Okay. So if somebody's had an uneventful pregnancy and delivery, then we know that second, third babies become easier. But nowadays, women are having smaller families, one child or two children maximum, and they don't want to walk on any path which could be ridden by any element of risk. Number one. Number two, you're monitoring your pregnancies more closely. The number of ultrasounds which are being done, the number of blood tests, the fetal medicine specialists which have come. We are monitoring the baby like a hawk. And at any suggestion of any risk, one wants to, I'm a doctor. If a couple comes and says, Doc, this is the only child we're going to, and my fetal medicine specialist tells me the problem, there is a late growth restriction in a baby, the flows are getting reduced, or whatever reason, then earlier, many years back, this information was not available to a clinician, and they would go along with the flow, say, go normal. But when you start technological advances and getting inference from them, then the whole ballgame, and you have to do risk stratification. risk stratification
Dr.
puts
Geeta,
a woman to a higher.
sorry for interrupting you, Dr. Geeta. Your voice is breaking. Technical snag is what I'm expecting. So, anyway, we just in the beginning of the show. I'm still waiting for the audience to join us in larger numbers to ask questions. Is it possible for you to refresh and come back so that we can have your?
Am I back with you now?
You are, but
Hello?
then there is the yes. You, I can hear you, but then there is a break in the voice in between. Can you speak it? Okay, Dr. Geeta Chadha is logging in again. Sorry for that technical issue. Internet
Yeah.
savior of the day. Also, yes, ma'am. Welcome back.
Yeah.
So
So,
yes,
Shanti, I was just saying, to cut the long thing short, is once the risk stratification is there, and I have been sounded off by my fetal medicine people that there are certain risk factors, I throw them at the couple and let them take an informed decision. Because I'm not somebody who'll carry a flag of go normal, go normal. Normal is end of the day, a woman is normal and the baby is normal. You know?
correct.
Yeah. For me, that is the bottom line.
Wonderful, ma'am. So, but then when I talk about a normal delivery as well, there are a couple of my friends who have experienced immense pain after their deliveries. It's like the stitches. It's then they had a lot of trouble after giving a normal delivery as well. Whereas I recovered really very fast. I came out with a C-section. I said I didn't have that much of effort. So the stitches after the vaginal delivery at the perineum, if I'm not wrong. So how
Yeah.
much of how many people does everybody require a stitch after normal delivery?
So again, that depends on the how, when the baby is coming out, the outlet of the vagina, the perineum has to stretch to allow the baby's safe passage out. If that is not stretching, and if that is not, allowing the baby to come out, the doctors traditionally have been giving a safe cut, because if you give a cut in a particular manner, the premise was that it doesn't let the ragged tears occur, because ragged tears have got no control and they go any direction. They can tear your anal sphincter, your anus, your anal wall, and all that. So doctors have been taught to give a little cut laterally, which a lot of people have had before, so that they know how to suture it back in place, and that allows the perineum to stretch and deliver the baby out. But in the same breath, I would like to say he's already had a delivery before, and that perineum has already stretched before. It is elastic. Second or third time, by and large, one doesn't need to give a cut, provided the baby, the doctor feels, is able to come out and there is no scarring which is holding the baby back. So this is something which the doctor decides at the last minute.
Correct. Exactly. So it's a last minute call. You cannot plan like how you have plans for a cesarean section. So this is something that you cannot anticipate before. This is
No,
to be
so
taken.
not at all. Delivery till the very end is a very dynamic process. And if somebody says something, it's not etched in stone. So the decisions and the viewpoint can always be changed, recall, depending on how things unfold. So a lot of times patients will say, will I deliver normally? Are you sure? I said, so far things are good. But one can't say, like, active labor pains, if the baby's heart starts dropping, the distress occurs, baby passes stools, things can be changed and the decision changes, and end of the day, you take out the baby in a safe manner. Likewise, you've delivered the baby vagina, placenta doesn't come out. So again, the patient has to go to the OT to remove it. So we never say it's over till the time it's really over. We say it's normally done vaginally till the time everything is out and done and a woman has spent 1 hour delivery safely in the postpartum ward, and then you say, okay, then you heave a sigh of relief and you say, thank God, all went well, normally vaginally.
So it's not just the baby coming out. There is so much more after the childbirth. That's what I understood today.
Absolutely,
And
absolutely.
and in case there are stitches, there's a lateral cut through the normal vaginal delivery. If there are stitches which are there on the perineum, How long will these stitches remain, and what is the care that one has to take care?
So these absorbable stitches, this cut is called episiotomy. By and large, a right-handed surgeon gives a right laterally. So it'll be on woman's right side, and you stitch it in 3 layers: the vagina, muscle, and the skin. So there is a lot of cutting, there's a lot of stitching, but luckily the nature has given such a tremendous roll back into normalcy after childbirth that every day she will recover by leaps and bounds. What she has to make sure is that the area is kept clean. She'll be bleeding. All women bleed normally after delivery. Bleeding occurs and then it changes to lesser blood called lochia. But that is a high culture medium. The blood grows bacteria and germs. So the woman has to see to it that she keeps the area clean. She washes it herself. In the hospital, she's taught how to have perennial washes. Every time she uses the loo, she splashes normal water and she touches it with a dab of some antiseptic. Betadine is very commonly used, and some antimicrobial ointment. And she makes sure that the legs are not really stretched too far apart, because sometimes, the stitches could be under stretch. And looks after them. And if the pain is too excruciating, then she must go back to her doctor, because normally put episiotomy stitches do not give so much pain to a woman, because a doctor orders antimicrobial drugs, anti-inflammatory medicines, so that a woman is able to carry on with her normal day-to-day functioning and looking after her child in the postpartum period. But if the pain is too much, I always tell my patients that is a red flag. There could be something amiss. Maybe a stitch could have, snapped, or maybe there is a local hematoma, which we may have to put a little finger in the vagina to rule out. So things can go wrong, and an alert patient should be able to raise that red flag and say, something is amiss, I'm not able to carry on, and I'm in too much pain. Some pain will occur till the stitches heal, and by and large it's over by 2 weeks. But during the process, if a patient finds, by and large, everything is over by 2 weeks and these stitches fall off. So I call my patients after 2 weeks for post-delivery checkup. And a lot of times when you are feeling the stitches, they come in your hand because the tissues have joined and the stitches are just coming in your hands. So 2 to 3 weeks, even a slow healer may take another extra week. But 2 to 3 weeks, the whole story is over and she's recovered really well.
Wonderful. So as you say that these are not the stitches which one needs to go back to get the sutures removed. So these are the ones which are absorbable, they absorb on their own or fall off on their own. So
Right.
there is anxiety. Half, not even more than half of our population doesn't have women don't even understand their anatomy well. So they are so scared. There's anxiety, taking care of the child, taking care of the responsibilities, which are new mothers' responsibilities, and there is something else going on with my physical body, and which is at anatomically at a position where I'll not be able to tell people that I require help or take care. This anxiety of understanding their own body, do you think that there should be enough awareness right from the beginning of the entire motherhood, the pregnancy?
Absolutely. And I think for that, the media and all the websites and platforms like that, which deal with healthcare, are doing a wonderful job. Women now are empowered with knowledge at the click of mouse. Whenever they have any kind of query in their mind and the doubts which the doctor's consult room, that short visit, couldn't satisfy their questions, they are able to, go to these sites and have their questions answered. And traditionally, even for the ones educated or who are not, who don't have the resources of going to internet, the collective wisdom of families in India was Jhansi. The mothers and the mothers-in-law and aunts, I think since time immemorial, childbirth has been into our continent in a big way. So everybody has an expert in the family and they give their own advice. So with such kind of background, people from such backgrounds, I'm sometimes helping them understand what is a myth and what is fact. But otherwise, I think we have a lot of knowledge here. People and big joint families set up in our country. Trust me, we are blessed to have that kind of support, because the minute a woman comes with many relatives, I know her nutrition is looked after, her well-being is looked after, and she's being told what to do. So I'm more comfortable when I have a woman surrounded by relatives.
Great. So, ma'am, there are a lot of questions around C-section as well. You know, the pain after C-section or the stitches, when will they be removed? Same as the vaginal normal delivery. So, what is the timeline for a C-section recovery?
So, as I told you, after 3 days, when the lady goes home, she has already started walking around in the corridors of the hospital. She's able to go to the loo herself. She's able to get up on her own and feed the baby and burp the baby. She needs support in the other things for the baby, like washing clothes and, giving baby a bath and all. But even in the hospital, these women on day 3 are walking to the baby bathing room and watching and learning the nuclear family, first mothers. So they are doing everything themselves. And when I call them on day 8, 7 days after the cesarean, for the dressing, even those sutures are absorbable. And when I call them, they come walking themselves. And when they go, Doc, can I drive? They say, these questions are asked very often, Doc, can I drive for my next appointment? So I said, look, take it easy, give yourself another week to recover, and then you drive. So the sutures, the OT, the meds, they are bringing this change about. This whole change when the recovery is much quicker.
Right. So here's a question from Kartika Sharma. Kartika has pain in stomach above the stitches, and how long does it take to recover from a C-section? So Kartika has not given us the time, kab hua hai, kya hua hai, and her age, and which. So request all the viewers to give us agar delivery hua hai to kab hua hai, age kya hai, and kaun si delivery hai. That will add on to Dr. Geeta's answer. So Kartika Sharma's question is also many women's question. I think pain in
Kartika,
stomach.
Yeah. So not all abdominal pain is stitches pain, because Jhansi, as you know, the uterus, which has expanded to a huge size because of childbirth, which is nearly touching the upper part of your tummy, after the baby comes out, the uterus has to come back to normal size. The original size is size of a pear. And that happens by a process called involution of the uterus, where it contracts and becomes smaller and smaller. It is during this process that the lady has pain. So why a doctor calls a patient for regular checkups for 1 or 2 or 3 weeks after the cesarean is to make sure this process of uterine contraction or involution is going smoothly. Because if it is lagging behind by what is supposed to be the norm, then there are things which we are supposed to rule out. A very common factor being an ongoing infection which the patient is not able to report. So if Kartika's delivery has just been 1 week or 2 weeks, this pain that she experiences could be the uterine involution, which increases while she is nursing her baby. Because at that point, hormones are liberated to eject the milk from the nipple and also contract the uterus. So look at the harmonious way in which nature works.
Wonderful, ma'am. So in continuation with this question, let me also ask the Sheila Modi, who's 28-year-old. How do I check if my uterus has shrunk or not? I still feel the discomfort, had a baby 2 months ago.
So in 2 months, the uterus should have gotten back. In a normal uterus without fibroids, without diseases like adenomyosis, 6 weeks is by and large the time taken for uterus to come back to its normal size. And that's why most doctors call the patients for a postpartum checkup one last time at 6 weeks. Some patients can't come at 6, they can come at 8 weeks. When the doctor does an internal examination and by bimanual palpation can make out that uterine size has come back to normal stage, and at that point then they are told that now they can be sexually active and contraceptive advice is given. So at 8 weeks, she won't be able to make out. She will have to go to a doctor to find out if uterus has come back to normal size.
All right. So there's nothing that a woman will understand if it's come back to normal size. There are no indications that I would feel what's happening inside.
So by and large, a subinvolution occurs, as I told you. Either there's infection or there are tumors, and these tumors a patient is aware of earlier. As far as infection is concerned, she'll say, look, I keep having bouts of heavy bleeding. I have a foul smelling discharge. I have a pain which is not going, or I get low grade fever, or my panty liners are lined by discharge which is purulent. So things like that should be telling her that she must go for a pelvic examination to her doctor.
Great. So, as you're talking about discharge after delivery, which is common, all of us think that once the delivery is over, कुछ नहीं होगा, फिर मैं dry हूँ, normal हूँ, मैं मेरा होगा. But then there is a lot of different kinds of discharge that we need to deal with. Here's a question around discharge, ma'am. Vijeta S. V. Reddy. 39-year-old female. For how long will the vaginal discharge continue after delivery? I also have a burning sensation along with discharge. Is this normal, ma'am?
So the discharge is because the baby is in uterus and there is a lining called deciduum where the baby is attaching to the uterine surface.
Sorry to interrupt you. Sorry to interrupt you, ma'am. Your voice had terribly broken while you were speaking the last line. Can you please repeat the line again so that Vijeta can get her answer properly?
Yeah. So I said when we have a discharge after delivery. Jhansi, can you hear me?
I'm still trying to place you, ma'am. Yes, we can hear you, but the picture is being frozen for a while, but it's okay. We can hear you continuously. Okay, today I think we are having a trouble with our technical. We are in the hands of.
Yeah.
Yes, ma'am. Yeah.
Better, Jhansi?
Much better,
Is that
ma'am.
better?
Please.
Much better. Yeah.
Yes, ma'am. So, Vijeta of discharge.
So the discharge occurs because the uterine line.
I think we lost your connection again, ma'am. So if you can just refresh and join the. Let's wait for Dr. Geeta Chadha, and it is very important for the family members to understand what's going on in a woman's life after childbirth. I see a lot of men who are typing their questions about their any special case. Yes, there are men who are asking about their wives. Himanshu Shah, we are going to ask your question in a short while once Dr. Geeta Chadha is back on the show. We are getting her back. There's a slight technical difficulty. We'll refresh and come back. And Himanshu Shah's question is yes, the mood swings question. We will talk about postpartum depression, also mood swings, altered regular day-to-day life में बहुत सारे mood swings के वजह से changes होते हैं. It's not just for the mother, but it's also for the family members to understand that this will happen and how to deal with it, because it's not just affecting her, but it's also going to affect the relationship and the people around who are working with her or family and friends. Well, Mridul, yes, we are going to ask your question, which is very important. We are going to talk about libido in a short while. And Sheila Modi, yes, your question is answered. Noora Mishri, your question also will be taken up very shortly. How will my stretch marks disappear? Well, very, very, very important question. We shall ask this question to Dr. Geeta Chadha. It's not only your question. I think stretch marks are post-delivery, not just post-delivery, but also after losing weight. And of course, a lot of you are asking about weight loss after delivery. We will also talk about that. Yes, Dr. Geeta is back.
Hi.
Ma'am,
Right.
tell me, ma'am.
Yeah.
Yes.
So the discharge, Jhansi, I was saying the discharge continues till the time the decidua falls off. And by and large, this whole thing is over in 6 weeks. In that period, a patient may have Some patients will bleed for 2-3 days and not bleed for 1-2 days, and suddenly the bleed would come. As long as the bleeding is not very heavy, you don't need to worry about this intermittent bleed. And slowly then the color of the blood changes from fresh red to orange to yellow and then white. And this is called lochia.
Which is called? Sorry, ma'am.
Lochia, Lochia.
Ah, okay.
Lochia.
Okay. So, also there's Kurra Govindarajulu. A friend has given birth 7 months ago. What diet should she follow? Okay, okay. I thought it was a discharge question, but that's okay. Govindarajulu is asking for a friend. So, any special diet for a mother?
Yeah, so if she's nursing her baby, and if she's exclusively breastfeeding, she must have very good diet, because baby is depending on the mother for all nutritional needs. So the
Yes.
milk is very high in calcium. She should have diet high in calcium, and we always supplement iron. So iron and calcium supplements are given to a nursing mother, and with that she must have a wholesome diet and nutrition. And this is not the time to go for dietary restrictions, but correct diet.
Very very important. अंडरलाइन करके बोलेंगे अभी डाइटिंग करने की जरूरत नहीं है, डाइट रेस्ट्रिक्शन की अभी टाइम नहीं है.
Correct.
Yeah. So it's in continuation with this question, okay, what specialized nutrition for a woman? Hira Singh's question: what steps can I take my breast milk make milk flow? So lactation is a very important question for newborn and new mother, where we have again anxiety comes into play. And how do you introduce them to a good way of lactation, ma'am?
So, I'm so happy that now every good center has a lactational counselor. And for us, the minute the baby is born, like if I do a vaginal delivery, I immediately, after the neonatologist has taken the baby, I say, give the child to the mother. And I tell the mother, would you want to put the baby to the breast? The idea I'm trying to use is that's the better. Earlier the baby is put to the breast, earlier are the hormonal changes which will initiate lactation let down reflex. And for initial 1-2 days, a mother may say, there is no milk, doctor, what do I give the baby? And I tell them that little transparent pearly fluid that is coming out, called colostrum, has got 100 more benefits than the milk itself. Because that is what is giving the whole immunity that the mother has garnered all her life through her body to the baby. And that baby is protected initially against infections that the mother has already warded off in her life. The milk letdown finally occurs from day 3 or so, where it becomes white color. And how she can ensure she has it? First of all, release the anxiety. Don't get anxious. Just be chilled and enjoy the process, and be happy that you successfully brought a human being into this world. Eat well, be calm, be stressed without stress, and just keep getting the baby to the breast every time you feel the baby is hungry or crying. And as the baby sucks, there are so many hormonal changes which occur that milk is not only formed but is thrown out. So it is a circle, a baby suckling. If a mother says, I'm no milk, so I will say, just still put the baby to the nipple. Let the baby suck and milk will come.
So that's nice. Is there any food that you would want to advise? Abhi, I remember my lactation days where my mom, my aunts, everybody from a relative had one recipe or something or the other. No, north and south, maybe for culturally there are certain foods which are given for lactating mothers. Would you advise any of these, ma'am?
Absolutely. See, end of the day, you need a substrate to form the end product. So a woman's nutrition has to be there. And as you said, culturally in South, I would want to know from you what you give. In North, they give laddus, which are full of wheat. They're called panjiris. Panjiris made of wheat and nuts, lots of nuts and
Gond
ghee
ke
and all
laddu
that.
bhi khilaye.
Gond, correct. Gond ka laddu. All these things, acacia, gond is acacia. All these things bind the nutrients together and make sure that these nutrients give a milk full of nutrition rich food. Omega 3 is there in ghee and nuts, and that is very necessary for a growing child's neural networks, the mind. And that's why traditionally we've been giving this. So I'm surprised, Jhansi, you say in South India also they are giving gond ka laddus.
Yes.
So
No, South Goans का नहीं, मैं नॉर्थ के बारे में बोल रही हूँ. यहाँ पर we give तिल वाले laddus with a certain amount of dry fruits. There is one til laddu that they give, and then there are certain fish, those very small fish in non-veg eating families, and in vegetarian eating families there are recipes with garlic, the fresh garlic, which they say that it'll help a mother lactate more. Then there are n number of recipes which are made especially with turai and all other vegetables which are included. Those
right.
little fish were mandatory for my the culture here that we were.
So see, that little fish is rich in omega 3, all these fats and all. So the child needs all these things. And when a woman says, "Doctor, I want to go back to my shape, size 0," and I said, "Look, you're with the wrong doctor, because you need to eat. You're looking after the nutritional needs of a young baby. So eat and eat well. If they don't want to go the ghee way, then have a full wholesome diet."
Oh, ghee was like, it's like you want to flow back into you lubricate yourself, your joints and your everything back. Ghee is something that is promoted. I used to stink ghee if my memories take me
Absolutely,
back.
absolutely. Ghee went out a decade or 2 decades back, and it's making an entry back. Even the nutritionists are
Correct.
promoting it. Yeah.
Correct, ma'am. So now let me take the question of weight loss. A lot of people, Minal Varade is asking, ma'am, need to lose weight after delivery. Please guide me. When is the right time to talk about weight loss after delivery?
So, weight loss, I would say, not through extreme measures of dieting. If you are breastfeeding, you have to optimize nutrition and exercise. So, exercise kicks in once you are 6 weeks post vaginal delivery or 2 or 3 months post cesarean. You can do whatever exercise you are good with. And I'm a believer of morning time for exercise, because that keys up your metabolic rate for the whole day. So there is no easy way.
Right.
You can't say that I'll just seal my lips and I'll lose weight. You need to burn out. And, Jhansi, if I tell you, if you exercise in the morning, your appetite optimizes. You are not heading for the carbs, and you're not feeling faint when you don't get sweets and carbs. Something in the body optimizes, and you go for nutrition when your body really needs it, because the body's rate, that is burning up what is already stored, becomes better and better. So for me,
Right.
optimize your nutrition and exercise in the morning. Outdoor,
Right.
1 hour. And I say outdoor, not indoors.
Outdoor, sun.
Yeah.
Yes, we got your sunny
Because
message.
you're the sun, you're getting your vitamin D.
Well, well.
Yeah.
Ma'am, Sunita is asking this question. After a C-section, when should I start back on my exercise routine?
So normal stretches and all in 2 weeks. Upper abdomen after 4 weeks. You can do upper abdomen exercises. Then lower leg lifts and upper abdomen at 6 weeks. And at 3 months, I tell my patients that forget you've had a surgery. You need to forget the fact that you've had anything and go on with your normal life if things are good.
Yes. Ma'am, what is it about climbing stairs after C-section? Is it not good? Is it good? What would you suggest?
So, most doctors now are giving line cuts, which are bikini cuts, called fan and seal scars. So, even if you climb steps slowly, they don't really bother you. But if somebody is living in a high rise and say, I can't rise 2, 3 floors, then I say, okay, simply sit on a chair and 2 people can lift you up. First time when you're going home on day 3. And when you come down, 1 week later, you come down. And once I've seen the dressing and the stitches, you climb back yourself slowly. So it's just that one time. Yeah.
Just for the initial, immediately
Right,
after the
initial
delivery,
3 days.
that you would want the initial 3 days. That's it, right? Chitari Geeta, 27-year-old. When will my period start again after delivery?
Right, so that is variable. If she is breastfeeding and exclusive nursing, 60 to 70% patients don't bleed while they are exclusive breastfeeding, and that means the baby is not on top feed, simply because their ovaries are not making eggs and the hormones are suppressed for periods. That is nature's way of not letting the mother lose through two outlets her basic nutrients, through blood and through milk. So nature conserves energy and puts it all the breast milk way. But if the baby starts having top feed and the mother is not really exclusively looking after baby's needs, then a woman can bleed in between. But if she bleeds earlier than 4 months after delivery, sometimes it's a problem because she may bleed too heavy. Because the hormonal balance has not normalized and regularized. So it's nice if she exclusively breastfeeds for initial 4 to 5 months and then starts introducing, say by 6 months, the weaning program, so that she has time for her own body to regulate her hormones, that when she menstruates, it's normal flow and it's not a heavy flow. My problem comes when a 3 month post delivery patient comes and she says, I was sparsely breastfeeding my baby and it is a top feed also, and she menstruates quickly and she's bleeding like a tap. And then to give her hormones is a problem because all those hormones go through the breast milk also.
Yes.
So it is a double trouble. I don't want the baby to have those hormones, whether it's a female or a male, should not be having these female hormones that I may need to give her to control her bleed. So I tell my patients, look, let's not get into that zone. You please try exclusive breastfeeding. And now the maternity leave is also 6 months, which helps me tell my patient that just do a kangaroo care for your baby now.
Done. Here's Shrimala Singh, who's 29-year-old, who's asking a question about bleeding. There's an abnormal bleeding during the first period postpartum. Why is it so?
Yeah, so postpartum means how many months is she postpartum?
Okay, so Shrimala Singh,
So
would you please type your question back? It'll be helpful for many other women also. I'll wait for Shrimala's question. Yeah, ma'am, you can, in the meanwhile, while she types back, we can continue answering, ma'am. She'll take it.
Yeah. So Jhansi, again, as I said, if she has started introducing top feed to her
4
baby
months,
for
ma'am. Thanks.
4 months, yeah.
Yes.
So I told
4
you
months.
4 months, earlier than 6 months, when they bleed, they pour. And then the doctor will see what is the cause and give her some non-hormonal medicines to try and stop the bleed. And I typically tell my patients that go back to exclusive breastfeeding, and in the meantime, I control that episode with non-hormonal medicine and tell her to go back to exclusive feeding. Unless she's had a pattern of abnormal bleed even before pregnancy, then she'll come back to that pattern, which will need then investigation. Like if she had a fibroid before, which was anyway she was a heavy bleeder, so that pattern will unfold again, irrespective of whatever, 4 months or 6 a heavy bleeder then.
Done. Meenu Ram is asking this question. What are the signs of postpartum depression and how long will one have to experience these?
So, postpartum depression is something which should be really handled. One should, if one is prone to depression, then getting postpartum depression is more common. If one doesn't have enough support and one is not having enough nutrition and is not getting enough rest, these people have more postpartum depression. And of course, as I told you, if somebody is already prone to depression, one should really catch the signals of this early. The signals being a patient would say, I don't have interest in anything. I don't feel like getting up. I want to be just sleeping and being in my bed. And I am resenting my baby. I don't even want to feed the baby. As somebody does not, if you don't pay heed to these subtle symptoms and signs, the suicidality comes up. She may become suicidal in depression, which becomes an absolute psychiatric emergency. So if you have these, whenever somebody comes to me in a disheveled state after the childbirth in first week or second week, immediately I'll talk to the husband and the relatives saying that support this girl more. Give her good nutrition, give her high fat diet, give her good head massage, body massage. Let her sleep and sleep. Don't let her have every 2 hour of wakeful state, because sleep does a lot of correction for the mind, is a mind healer. So if a woman is being, those super women who says everything I'll do, that can't happen because her body needs to be rested too. But if, in spite of these measures, if her depression is not going away, we may need to give her some meds with the help of the psychiatrist.
Yes, and also she was also mentioning about she has delivered 3 weeks back and she has extreme mood swings. Also, Himanshu Shah has written, my wife had a baby 4 months ago and is still experiencing mood swings, doesn't want to see a specialist, please help.
She needs to be given some medicines which are safe for her and which are safe for the baby. If she was prone to mood swings earlier, then it becomes all the more important that she seeks help. And if she doesn't want to go to a counselor or whatever, then if the past history was there, whatever medicines she was taking, then through teleconsults, Jhansi, these days one doesn't have to go to a doctor. If she already has a previous prescription, she just needs to, through any platform, connect with the doctor through teleconsult, say out her symptoms, and safe meds could be given, which could be safe in breastfeeding. Here I just want to add a bottom line, that a woman with postpartum depression will do more harm to the baby than she'll do with the meds which are being prescribed by the doctor for the baby, because here she's completely disinterested in the baby. She may not, it's so important to gel with your baby, to hold the baby for your own comfort and for baby's growth. So a woman who's in a depressive, mood swingy set of mind may not be able to do that, whereas a simple medicine which is safe will change the whole thing. So she must seek help.
So Himanshu Shahji, make sure that some way or the other, make sure that she's getting a consult with a specialist. Apollo 24/7 also has online consultation. Great. Ma'am, there are two important questions that people are asking about. One is about libido. Mridil Mrinal Das, 26-year-old. I had a baby last year and I still feel low on libido. Should I seek a specialist guidance or this is normal?
Okay, so this is very important, and I face this every day in my clinical practice. A mother who's got a young child, right? She doesn't, because there is too much on her plate. She has to look after her work, her home, her baby. And for a woman, a sexual drive comes from the mind, a mind which is relaxed. On top of that, if she has a husband who's needy, who's wanting to be first on the list, which he was before the baby came, and she's not able to cater to that, or a husband who's not really helping out with the domestic chores. Why I'm saying that? Because these women come and vent, and they say, Doc, my mind is not into this because my mind is full. I have to do 100 things, even if I'm on maternity leave, but I've got so much on my plate, and by the time it's night, I know I have to wake up again in the middle of the night to look after the baby's needs, because 1-year-old gets up. So libido is the last thing. But if in spite of health, in spite of rest, in spite of no resentment in a mind against a spouse, if her libido has really gone down, then yes, there are some medicines to push it back up. It's the hormonal changes which she's experienced, and those hormonal changes with certain nutraceutical medicines, she could be bounced back.
Wonderful. And in continuation to the same question, Sneha Sarita is asking, 26-year-old female, when should I have my first intercourse post-pregnancy? I delivered 6 months ago. Is it also different from a C-section and a vaginal birth, ma'am?
No, she should have had it many months ago. 6 months, what is she waiting for? I don't understand. For me, 6 weeks. If either cesarean or normal delivery, when the uterus comes back, and that, as I told you earlier, when I call my patients at 6 weeks, when I do a pelvic exam and I find things have come back to place, that's the time when I give her a go ahead for sexual interaction. and discuss contraception, which is a very important aspect of postpartum care. So 6 weeks for
Right.
me if everything is going good.
Wonderful. So, Srilata Ramanujan, 37-year-old female. What are the common postpartum complications? Of course, we've been talking about that, Srilata. But planning a family, but I'm nervous because of all the postpartum issues I keep hearing. Well, now this is the time that we've come to a corporate generation, the IT generation, where they are thinking of children after 37, 38. So the anxiousness is the same as before, but the age is caught up. What would you advise these women in corporates as well, ma'am?
So I tell people at 37, 38, when they come to me and they say, we are now thinking on embarking of journey to have a baby. And I say, for God's sake, guys, don't think, just take the plunge. Just do it. And if everything is good, I'm not even going to advise on to test because you're already 37 and they have to be made aware that biological clock ticks and your eggs get old. So one consult quick test and I say, look, if these tests are normal, don't even come back to me. Start your preconceptional supplements that I prescribe. And if you don't conceive in the span that I tell you, and for the bar is lower for women who are older than 35. Normally I would say 1 year try for younger women who are 25, but for 35 plus, I don't spend so much time because I know their eggs might be getting older every day. So the bar is lower and I would intervene to investigate much earlier and I tell them now take the plunge and do not think. Because beyond a point thinking is waste of time.
Yes, ma'am. Kanti Sharma's question, 33-year-old female. I had excessive bleeding while giving birth. It continued for a few days. I still feel very weak. It's been 2 months. What can be done?
So by and large, you build back your hemoglobin. If you've lost blood, your hemoglobin would have dropped and with the blood, other nutrients would have drained out. But in 2 months' time, body is like desert. Jhansi, if you've lost something, it sucks out. Whatever you eat, it sucks out the nutrients which it is deficient in. So if she's still feeling weak, she should do the basic labs of CBC, vitamin D, vitamin B12 and other things. And if all is okay, she just needs to recharge her batteries and sleep better and eat better. A lot of times people feel they feel weak just because they've not rested enough. And sleep is a huge thing to recharge your batteries. So not all weakness is because of disease. All it needs is a happy state of mind and a well restful good night's sleep.
Wonderful, wonderful. So here's the next question, ma'am. Purushottam Mehta, 37-year-old male. Okay. My wife is still experiencing urinary incontinence after 1 month of delivery. What can be done?
So in her case, maybe she had a little bigger baby that came out which stretched her system and the vaginal laxity is pulling on the urethra urine pipe. At 6 weeks, her doctors should be teaching her exercises which are called Kegels to tighten because the tissues go back very fast. With that, the nutrition has a huge role. She should have good diet, high in protein and high in all the nutrients that we have already mentioned for a lactating woman. And with that, exercises. And she should not be putting pelvic pressure. Like she should not be squatting for long, sitting on the pot for long to push through a constipated hard stool. So all these things should be explained, but the doctor should be teaching her pelvic exercises to tighten the pelvic floor muscles.
Done. So almost like any other urinary exercises or Kegels exercises to, it's
Kegels,
just the same as Kegels.
It's the same,
All right.
and the longer she does, the better.
Wonderful. And the last question is, ma'am, Harmeet Kaur, 33-year-old, how long does it take for a baby's head to gain normal shape after the birth?
How long does it take for baby who?
Baby's head to gain normal shape after birth.
So that's a question for neonatologists. But by and large, babies, they have gone through a tumultuous journey while having their passage out to the birth canal. And their shape resumes. So you've seen sometimes they are given that little round pillow so that the head rounds up and their bones in the head are very pliable. They take the form. So by 6 weeks or so, they've formed a good shape of the head.
Done. So I think that's it, ma'am. For today, I think I'll have to wrap up for the questions because we're running short of time. And thank you so much for giving us wonderful information. So I want you to give me condensed top tips to take care of a new mother getting back on track after childbirth. Will you please give me some top tips?
So my top tips are that childbirth is a physiological state of body, and one should take it as that and not get too overwhelmed by the whole process, because there are enough healthcare professionals who are helping you and who are giving you the right kind of information. So don't get scared and overwhelmed by the wrong inputs. And doctors from the very beginning, and there are platforms like Apollo 24/7 who are there to dispel the myths. And take your nutrients, which are very important. Take a good diet, register yourself with a good healthcare facility so that safe deliveries should be embarked upon. And if everything goes well, you are on your feet doing everything normal sooner rather than later. So thank you very much for having me, and I hope this talk was of some use to all of you. Thank you.
Of course, ma'am. It was very, very enlightening. Thank you so much. It was very positive. It made it look as if it's easy for me to, or it's doable, rather than the anxious, stressful condition that I keep hearing. Like for one of our viewers did mention that it was really tough for her to postpartum issues के बारे में सुन के उनको anxiety होता है. But you have relieved us from all of this anxiety. Thank you, Dr. Geeta Chadha, for this wonderful time on a Sunday morning.
Thank you. Take care. Bye.
Yes, that is Dr. Geeta Chadha, and thank you all for joining us today. We are getting back to get back on track after childbirth. Apollo 24/7 can be your partner for online consulting or medicines or lab tests, anything. Apollo 24/7 can be your partner. So download Apollo 24/7 and you can use this coupon. You can get doctor consultations direct from Apollo, get 150 rupees off on the first online consultation. Use the code FIRSTVC and you get 150 rupees off on the first online consultation. But also, while you're ordering medicines from Apollo 24/7, order medicines direct from Apollo, get 25% off on online medicine orders. Use the code FIRST3. First 3 is your code. So download Apollo 24/7. And to our viewers, this is an exclusive coupon. Use the code HH247 to get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. So thank you all for joining us today. And next week, we are coming up with a topic that we all require: top tips to beat acidity. We are going to talk about gastroenterological issues. Tune into Health Hour on 3rd July 2022, 11 a.m. You cannot miss this important session. So if you don't want to miss, do one thing, go ahead, subscribe Apollo 24/7's YouTube channel. Also, make sure that your notifications are set on so that you'll get a notification reminder. You can also follow us on our socials, Instagram, Facebook, to get connected. Thank you, all of you. It was wonderful. Thank you, Dr. Geeta Chadha. And we shall see you next week. Namaskar.